you, Mrs. Fox. Mr. Cardoza.
Thank you, Madam Chair. I appreciate the debate. I sometimes think that I wonder if the Saturday Night Live folks are watching, because if they are, they'd have a field day with some of the things that are said and done around here. But I just hope that tonight I can get home in time to see it. I don't count on it either. I want to try and talk about the situation that befalls my constituents. I want to talk about my true life experiences, because I think that we need to put all this into context. There is tremendous pain out there in America with regard to people who can't access health care, that are denied coverage and benefits, even that they have paid for. And so I want to take some time to talk about that. But before I get into all of it, there's this notion out there that the American people aren't for health care reform, and I want to disabuse some folks of that. And, you know, we get this loud and hysterical group of folks that think that if they're just louder than everybody else, that their side will prevail. So one of the things I did recently is I took all the calls that I got in my office. We got thousands and thousands and thousands of calls. My staff's ears are sore on both sides. And we log them all. They take down folks' statements. And we count up all the letters, pro and con. And then we eliminate the duplicates. And in my case, I eliminated those that don't emanate out of my district. And I had 3,900 people out of all those 1,000 calls say they were for this bill. And I had 2,200 people say they were against it. So I just want to just lay out those facts. In my particular case, in my district, where I think it's only 20 or 30% of my folks have private health care insurance, and nearly 25% of my folks have nothing at all. They're for it by a wide number. And, you know, some of you know that my wife is a family doctor. She's been one for 20 years. She's seen thousands and thousands of patients and had to deal with hundreds of insurance policies. And her experience is miserable. She comes home every day telling me that there are some of her patients, good people, hardworking Americans who pay their taxes and pay their premiums, who, when they get sick and need coverage, are denied that coverage. And I've heard her on the phone yelling at the executives in the insurance companies to let her practice medicine the way she was taught in medical school. My gosh, what a concept. To not have someone on the other end of a phone at an insurance company telling the doctor how to practice medicine in this country. I just can't believe it sometimes when I hear people say, well, you know, we're going to have socialized medicine. We're going to take the doctor out of it. We're not advocating taking the doctor out of it. We're making sure that the doctor's making the decision and not that insurance company. That is incredibly important. I want to tell you about a second real-life experience I had when I was a very young child. I was 6 years old. I needed kidney surgery. It was an emergency situation. My parents took me in. They didn't know what it was. And I had to lay on the table because we didn't have any insurance until my dad went out to the local bank and mortgaged his business to pay for the surgery I needed. That's what's real life for so many Americans. And you know what? Today, with all the lending regulations and the banks that are impersonal, they're in grocery stores, they're not the community banker that we used to have in 1966 when this happened. I'd have been laying there a long time waiting for that surgery. I was in significant pain. I'm going to tell you about my brother this week. Well, it was actually about 10 days ago. Called me up. Now, my brother's probably a Democrat only because he can vote for me in primaries that way. Very conservative man. He called me up. He's run our family bowling business for 50 years. And we've all been in the, he still owns the family business that's been around for 50 years. And he said to me this week, he said, Dennis, I just got the call from our insurance agent, Tom Murphy, in Livingston, California. And he said that our premiums are going up 75% this year. 75%. He goes, but add insult to injury. Your sister-in-law Joyce is in the hospital, as you know, having knee replacement surgery. And on the very day that the insurance company jacked up my premium 75%, they denied her extra day that the doctor wants to keep her in the hospital because they're afraid she's got blood clots. And so they're insisting that we send her home instead of paying for the extra day. That's what's happening in America right now. That's what we got to deal with. That's what the American people care about. They don't want to be discriminated against because they had an illness one time and it might come back. You get cancer, you can't get insurance. You're denied. Doesn't matter if you got over it. If you have a child with leukemia in your family, you can't pick your insurance policy. You're lucky if you can get anything at all for your family in those situations. In my county, we have 22% unemployment right now. We have 30% foreclosures. We got devastation. My county hospitals, we used to have, I think, 5 hospitals in my county. Now we got 1 and a little one satellite. They've all closed down because they couldn't compensate for uninsured folks. They couldn't make it. The one that's still going is subsidized heavily by local government. Instead of paying for cops, instead of paying for firefighters, we're having to cost shift that tax dollar, those resources, into health care. See, it's worse than that, though. Because my businesses that we have in our communities, they pay higher premiums in their insurance because the uninsured don't get compensated. The hospitals don't get compensated in the same way. So if you're uninsured, you pay $2,000 government program. The businesses, their insurance that have insurance, those insurance companies pay $5,000 a day. That's the tax on small business. That's the tax where the small businessman is subsidizing it right now. We're trying to fix those situations. We're trying to fix that in this legislation. When I was 22 years old, when I was 22 years old, I was an intern here in this very Capitol. Ted Kennedy was holding hearings on health care for all Americans. I was dispatched by my congressman, Martin Frost, who used to sit where Mr. Dreyer does now, and I had to monitor those hearings. 22 years ago, or when I was 22, actually it was 30 years ago. God, I wish it was 22. I listened to these very same arguments. The very same people that are fighting health care reform then are the ones that are fighting it now. They don't care about the patients. They will continue to have this fight for the bottom line. Now, I'll tell you, I'm not sure we're doing everything right in this bill. I was honest today about the rule. I thought we needed to change it, and I'm glad we did. But I'll tell you, I'm also going to be honest that we have to do health care now. This is our time to do it. And we can come back. There's going to be a lot of amendments here offered by Republican colleagues and some of our Democratic colleagues. And I'm not going to entertain any of those today because it would subvert us getting this done. But I will tell you that they're going to come up with some ideas. And when those ideas are put forward, some of us should put some of those ideas on the table after this bill passes. And I believe it will pass. I want to tell you all that I'm going to vote for this bill today. And I'm very proud of the fact that I am. And I hope that we make this change for the American people, for the small business owners like my brother, for the little girl who had leukemia in my hometown, and the insurance company told her she couldn't go to the hospital who had the best success rate. she had to go to the hospital who had a much lesser success rate because they got it cheaper there, and she passed away. I'm going to vote for this bill proudly because we need reform. Now, I will also tell you that there's going to be some ways that we can reduce costs further, and we need to look at those. We would look at them in this bill, in conference committee, if Mr. McConnell hadn't said that there will not be any conference committee action. That we can't go to conference. Because I would have liked to gotten more cost containment in there. There are people like the West Wireless Institute in San Diego where they're doing innovative work to reduce costs. We need to listen to those people and employ the methods that they're advocating. Thank you for the time. Thank you for listening. I appreciate it very much.